Hello, it's been about 3 or 4 weeks since my last video detailing my recovery from PRK on my left eye for a touch-up for correcting farsightedness. And in my last video I was really discouraged because of the ups and downs that I was dealing with, and since that time I have seen some improvement. My up-close vision has gotten better. When I hold a book up, I can read a little bit better. At a distance, things are still very blurry though. In the mornings, I can see stop signs, license plates of cars in front of me, large billboards, things like that. But text that's smaller, I still have a very difficult time with. And then as the day goes on, it gets worse and worse as I'm sitting here in my office at my computer with my computer screen basically at a normal distance away, just a normal reading distance away. The text on the screen is pretty blurry unless I increase the size a good bit. And so although I have seen some improvement, I'm still not where I think I really should be, still feeling a bit of eye strain because my eye is trying to focus and can't. Also, pretty surprised still at how much discomfort I'm feeling in my eye itself. The pain right after the surgery, the first few days as my eye was healing, that extreme kind of sharpness and sandpaper-like feeling faded. But every now and then I get a little bit of that comes back. And then, like for instance today, I'm feeling kind of a roughness, almost like a sandpapery type feel to my eye. I don't know whether to chalk it up to the dryness. I'm using my little eye drops. My doctor basically said to use them once an hour. I'm using them probably once every 15 minutes, and even still experiencing quite a bit of discomfort from what I assume to be the dryness. I don't really know for sure that's what it is, to be honest with you. And so still dealing with a lot of issues, still not really all that pleased with what's going on, although I have seen a little bit of improvement in my vision. But it comes and goes. Since the last video, I've had 1 or 2 days where sitting in my chair at home, looking at the TV screen, when I pull up the guide on the screen, I've actually been able to kind of read some of the text on the guide, and our living room is fairly good size, so I'm sitting at a pretty good distance. But that doesn't last long, and like for instance today, I know that I'm not at home, but I wouldn't be able to read it right now. I can tell by looking at other things around the office and things. So still a great bit of struggle in dealing with this. The recovery again is taking a very long time. And this strange feeling of kind of discomfort. I wouldn't really call it pain, but definitely discomfort in my eye. And it's almost like if you've ever worn contacts. I used to wear disposable contacts, and they'd be good for about a month. And when you get down to kind of the end of the month, if you've had one of those days where you've been wearing them for a long time, and you get to the end of the day and you're just ready to take them out, you just can't wait to get the contact out of your eye because the way your eye feels, that's kind of how it feels, but it just won't go away. I can't pop a contact out because there isn't one, and so the discomfort and the feeling won't go away. Eye drops help a little bit. When I wake up in the morning, the first thing I have to do is drop an eye drop in my eye because it feels like the surface of the Sahara Desert on my eye. And then I have to use eye drops every few minutes after I wake up until it finally kind of subsides a little bit. And so still a lot of troubles, a lot of issues. Here we are 4 months after the surgery, and still not where I would hope to be. Trying my best to be patient. There's really nothing else I can do. I just have to wait, but hoping that it finally gets better. Keeping in mind that the doctor said it could take 6 months to a year before everything finally settles down. But again, if you're farsighted and thinking about PRK or LASIK, here's my story. Hopefully it gets better, but you may want to think twice about this.